Hi, I'm Chris Newmarker, Managing Editor of Medical Design and Outsourcing, a MassDevice resource.
And I'm Danielle Kirsh, Assistant Editor. Today we're going to be talking about cardiology breakthroughs.
Cardiology breakthroughs couldn't come soon enough because heart disease is the #1 killer of men and women in the United States.
And did you know that about 1 in every 6 healthcare dollars is spent on cardiovascular disease, and it's predicted to be the most expensive and common killer by 2035?
Sounds really expensive. We have seen a slew of major research advances related to new cardio devices and diagnostics. That's the good news. Here are 5 cardiology breakthroughs that we think are worth mentioning.
3D printed heart cells have shown success in reducing heart failure. Using a 3D printer, researchers could grow heart tissues onto a 1-micron resolution scaffold using human cells.
The cells improved heart function and lowered the number of dead heart tissue, and there was improvement in cardiac function, blood vessel density, and cell proliferation.
There's also a robotic heart sleeve that can aid the beating of a failing heart. Researchers at Harvard University and Boston's Children's Hospital created a customizable robotic heart sleeve that never meets blood.
The researchers have claimed that the soft robot has advantages over heart assist devices like VADs because the sleeve doesn't touch blood. It reduces the risk of blood clotting, or those with the sleeve implanted in them have to take blood thinning medication.
The researchers have demonstrated the use of the robotic sleeve in pigs with acute heart failure, but it still needs more research before it can be tested in humans.
And in the last piece of good news, new data from Prevencio has demonstrated that a simple blood test could accurately diagnose heart disease in just 2 hours.
Prevencio and Massachusetts General Hospital researchers have developed a multi-protein blood test that could diagnose obstructions in coronary arteries, leading to the prevention of a heart attack.
The test results showed that the blood test could successfully detect the presence of a coronary obstruction 90% of the time, which in turn was able to predict the risk of a heart attack.
And it was also cheaper than the average $2,000 cost of a cardiac computer tomography angiogram or the average $47,000 cost of a cardiac catheterization.
So recent breakthroughs don't just include potentially beneficial innovations. They've also been some words of caution about the devices and treatments already out there.
Yeah, and a Stanford University School of Medicine team of researchers discovered that some implantable cardioverter defibrillators that deliver shocks could do more harm than good.
Now, the study was funded by Medtronic. The Stanford researchers examined the data of patients who have ICDs and received shocks between 2008 and 2010. Now, sometimes the ICDs delivered shocks when the system had a problem or tried to fix irregular heartbeats that didn't need fixing.
Over 1/3 of the shocks were unneeded, and those who received unneeded shocks had to have some form of follow-up health care.
Now, the healthcare costs following a shock can range anywhere from $1,300 to $20,000, regardless of if the shock was needed or not.
And ICDs aren't the only thing that's inaccurate when it comes to the heart. A recent study by the University of Leicester showed that when the cycling test that helps determine whether people with aortic stenosis need open heart surgery only has 60% accuracy.
The test is supposed to determine whether a person needs surgery. If they become breathless, it is recommended that they have valve replacement therapy. Almost twice the number of people who became breathless during the cycling test did not develop aortic stenosis symptoms within a year.
And that's all the time we have for these cardiology breakthroughs.
Now, you can read more online at medicaldesignandoutsourcing.com, where you can also sign up for our e-newsletter to get medical device news and innovations right to your inbox. Until next time, I'm Chris Newmarker.
And I'm Danielle Kirsh.